Hey, this is Teresa Kenny of the Hormone Genius podcast here with my co-host Jamie Rachi for an awesome episode on the Hormone Genius. We're going to be talking all things post-birth control syndrome or coming off the pill and what to expect when you are coming off the pill and how to process that, what to do about it, what should I expect? How can I help these symptoms that I'm experiencing post pill be better? So, Jamie, both of us feel like we have a pretty good understanding of this. I think it's a pretty new topic in some ways. We know that a lot of doctors are not educated about this, just like they're not educated about the woman's cycle. So it's kind of an area that's emerging, and we really want to dive in because I think a lot of women are experiencing coming off the pill and experiencing some of these symptoms.
Yeah. And it seems too that when women are awakened to the genius of their hormones, it just seems to be that the next step is that question of should I think about getting off my birth control? Jamie and Teresa and other people, things I'm reading, people I'm talking to are talking about, man, the effects of birth control and gosh, what would my life look like without it? And I think one really big fear factor, Teresa, and I'm sure you see this a lot more than I do, is this whole idea of like, oh my gosh, though, I don't want to be on the pill, but it's my only option because if I get off the pill, and pill meaning just hormonal contraception, if I get off hormonal contraception, I'm going to suffer like I did, which is why I got on the pill in the first place. Like my periods are going to come back with a vengeance. I'm going to have terrible acne or terrible whatever. So let's kind of dig into, Teresa, into why women are put on the pill in the first place beyond just birth control.
Yeah.
And then we kind of dig in and talk about what happens when we get off birth control and reasons women do and what they notice.
Yeah. I mean, so that just goes to the stat that basically over half of women that are placed on birth control really are placed on it for a symptom, right? For a medical symptom, not for, hey, I would like to go on birth control. A common scenario might be a woman going off to college, and maybe she goes into her doctor's office and the doctor says, hey, you're going to college. The responsible thing might be here for you to be on birth control, right? Because they're thinking she might be in a situation of needing pregnancy prevention. So sometimes it's not even the woman like already like looking for birth control. It's not even that. It's like the doctor saying this is a preemptive step that you should be taking. And then the woman has to deal with the fact that she's like, okay, you're going to give me this medicine. How is it going to influence my body? Mm-hmm. And I don't know. I just think about how crazy that is, that again, you take a normal, healthy woman and you're just going to say, hey, take this medicine. It has some side effects, but it's going to be better for you than not being on it. And I think that probably happens to a lot of young women, really going into high school, college.
Yeah. And I was just going to say, yeah, high school too. And, mothers can, and I understand that it would be very, anxiety inducing thinking about, your daughter who might have a boyfriend now and birth control and all these things, but even then, having that conversation, I have a friend who was not even having sex with her boyfriend in high school, but her mom made her get on the pill. Mm-hmm. And she's like, I'm not. And the mom didn't believe her. And so I'm like, oh my gosh. So, I mean, having those conversations, even though they're so hard, I'm sure they're difficult and it's not an easy conversation. But it's just surprising to me the number of women who come to me who are mothers of teenagers who say, I'm thinking about getting my daughter on the pill. I'm like, well, have you talked to her about it? Well, no.
Yeah.
So, I mean, talk about this with your daughters, whether they're in high school or college, and just have that conversation. And if you're not aware of the effects of birth control, hopefully this episode will help you. But even earlier on in the season, I think season 1, we talk about 5 reasons to ditch the pill. So give that a listen to, because I think that'll help too.
Yeah, because this is about education and empowerment. Again, in the end, every woman gets to make the choice, but you can't make the choice if you don't have the education first. And how often do we see that women make these choices without knowing the potential side effects, short term, long term? And then also, they don't even know how they get pregnant to begin with. The common kind of myths that exist that, well, you're taking a pill 30 days out of a month for a time period of being able to get pregnant, and it's only like 3 to 6 days at the most, and your egg only lives for 24 hours. So all of these kind of myths and just lack of education about how our fertility works. So women should go into these decisions with all of the information first. And then in the end, the choice is yours. But I think what women don't know is, what other alternatives exist, not only for, planning their families and avoiding pregnancy, but also for how to deal with these underlying medical issues that they're experiencing, the symptoms of their cycle. And that's probably what we're going to really focus in on mostly today, because that's the experience of most women. I hear these stories every day: painful periods, acne, PMS, ovarian cysts, irregular cycles, no periods at all. I mean, these are the things that women walk in doctors' offices with and walk out the door with a prescription for hormonal contraception. And they don't know there's an alternative that exists to help their natural bodies function and be balanced normally.
Yep. Amen. Amen. So, women, again, if you've been listening to us for any number of months or days or weeks or whatever, you know that we talk a lot about natural systems for avoiding and achieving pregnancy. But I really too want to talk about, Teresa, when women get on the pill, like you started at the very beginning, over 50%, I think it's even 60% of women are put on birth control because it's either a combination effect of birth control and gynecological. And I think 35% is gynecological alone, like some health concern. Okay, so now we think about these women who are put on the pill for, again, a gynecological health issue, whatever that case may be. And they're thinking, okay, we want to get off this. So what am I to expect? Like when I get off the pill or some hormonal contraception, and again, the longer I've been on it, the more of an effect I'm going to experience. Likely women will notice something again called post-birth control syndrome. And it refers to the collection of signs and symptoms that develop when we stop, of course, birth control, which makes sense because birth control affects our hormones, and our hormones affect every organ and system in our body. So if we stop taking something that we have been consuming every day, like hormonal contraception, we stop, which I affirm you in doing that. We just want to be sure that that some of these things can be considered very normal in terms of some of the symptoms that you may experience. And then by the end, hopefully, of this episode, we'll give you some real tactical guidelines to help work through that, with supplement recommendations and things like that, if you're considering getting off birth control.
Yeah, sounds good. Yeah. I mean, I want to say one thing right now, because like this is one of the questions I get asked a lot is, can I just stop? So here's one question: can you just stop birth control? Mm-hmm. Oh, yeah, you can. Yeah, you can. Sometimes I'll say to people, well, if you want to finish out the pill pack in terms of you get to that sugar week, the different colored pills, you can do that. But whenever you stop is okay. Nothing bad is going to happen. Remember that hormonal birth control basically just suppresses the naturally functioning cycle. So it's literally just quieting your actual reproductive system. When you come off of it, the first thing that's going to happen is it will wake up. Now, it may not wake up right away. And this is a problem with post-birth control syndrome, is that some people, it takes a while for the body to awaken those natural hormones. But yes, you can just stop. That is okay.
Mm-hmm. Yeah, totally. I know I get that question a lot too, and it seems so surprising. And then talk, of course, to your husband or whoever, of course, and knowing that you have a plan following that. But yes, in terms of some of the symptoms you may experience, let's say you decide to get off of it. Again, it depends on how long you were on it in the first place. But one of the things, Teresa, that I hear a lot about is acne. Mm-hmm. So let's first talk about that. Why do women experience acne when they discontinue the birth control pill?
Yeah, there's two. Yeah.
Oh yeah. And second question is, how long may that last? Mm-hmm. And what's kind of the clearing, right. How do they know once they've kind of overcome that?
Yeah, there's two reasons why someone might have acne coming off of the pill. One may be because they had it before going on the pill, right? Any symptom that you had previous to being on the pill can come back because you never addressed that underlying issue to begin with. Or it could be for a second reason. And that is because the vast majority of hormonal birth control basically increases a hormone called sex binding hormone globulin. And then it decreases, therefore, because that hormone like gobbles up your testosterone. So it's decreasing your testosterone levels, the androgens or male like hormones that circulate in every woman's body. And here's the deal. If you do that for a long period of time, or even a short amount of time, when you come off of those hormones, there's a rebound effect. So all of a sudden, that sex binding hormone globulin is going to decrease and release some of that androgen response, those testosterone hormones again. And testosterone will go quickly sometimes to receptor sites. And receptor sites for acne on the skin and the hair follicles can be stimulated. And that can produce a hormonal like acne. Sometimes we think of it as being more on the jawline or around the face, but it could be anywhere. It actually also can be on the back, referred to as backne. And that can be super frustrating. In fact, I've had patients where it's not on their face at all. They just have all of a sudden back acne.
Mhm.
And again, it's this kind of like rebound effect from these like suppressed hormones that rebound those testosterone levels, and then just really kind of hit those receptor sites.
Yes. So if you notice acne or backne, no, okay, it's for a time. It's for a time, but it's not just what your life will be like unless, again, like Teresa said, you had that acne before going on the pill. And in that case, again, it's a sign that you have something that we should address, at the root cause. And just digging into that a little bit, and it actually ties into a lot of the post-birth control syndromes, and a lot of the reason women are put on the birth control pill in the first place is this estrogen dominance. When we have so much estrogen because of environmentally, the water we drink, the air we breathe, I always say it's hard to get away from fake estrogens, estrogens. It's just hard to get away from it. So sometimes we notice that excess, acne and bloating and kind of low mood and heavy bleeding and all of that because of excess estrogen. And so if you had that before you got on the pill, and then the pill in a sense stabilizes you, it seems, and then you get off of it, likely you'll still experience those things. So it's just a sign for you to really think about your lifestyle and work through maybe doing some cleanses. And I love talking about all that, so if you have questions, you can go to my website, fiatliving.org. But yeah, how do we stabilize that, and how do we decrease the toxins in the xenoestrogen?
Right. And so the estrogens you're kind of talking about, let's just remember those are unnatural too. Like they're not really just estrogen. It's not a natural hormone. Like again, natural estrogen is not a bad thing. It's just these xenoestrogens, they're attaching to receptor sites where our estrogen is supposed to naturally function. And it's causing an unnatural response and a dominance of these types of hormones. So the second thing that causes estrogen dominance, and it may be a reason why someone went on the pill that had acne, would be polycystic ovarian syndrome, right? So polycystic ovarian syndrome, a condition very common. Increasingly, we're seeing that over the last probably 50 years, I think it's at least up to 15, almost 20% of reproductive age women with this polycystic ovarian syndrome kind of syndrome, this effect going on in their body. And it also causes androgen excess. So again, more dominance of male-like hormones, irregular cycles, but the dominance of those hormones causes the acne. And someone will be told, hey, birth control is a answer to polycystic ovarian syndrome. And it's one of my biggest pet peeves, because I really think it's the exact wrong thing to do for PCOS, because they're already estrogen dominant.
Mm-hmm.
And then you're going to put them on more synthetic estrogen. They're already struggling with insulin resistance. And we know that birth control actually causes a lack of sensitization to glucose or insulin resistance.
Mm-hmm.
So in my opinion, it's just a really not great treatment for it. Now, could it improve acne? Yes. And that's because, again, what does hormonal contraception do? It binds up that testosterone, so it decreases it. But here's the deal. It's not a long-term solution to your problem. And when you come off of it, the acne will come back. And so now we have to figure out, what can we do for the acne that's a true permanent hormone balancing natural solution to that problem. And that could, again, Jamie and I talked even before, acne is such a complex issue because not because acne is like that complex. It's just there's so many kind of different ways to tackle it.
Right.
And it can be dietary and lifestyle. So one of the most researched areas around nutrition is dairy and sugar. So there's two things you have to look at for acne in your diet to help, decrease some inflammation on the skin. Dairy, definitely, and sugar would be the other one. And processed sugars obviously being the worst.
Yeah.
And then, of course, you can tackle acne topically. And, we all know there's a cajillion topical solutions for acne. And that's where it gets kind of like overwhelming and mind blowing. So, I mean, there's certainly things like CeraVe cleanser and Cetaphil, some really good brands, right? Neutrogena, some products out there. And there's a ton of organic things. And I'm sure everybody could email us with their favorite topical cleanser, so we're not going to get into that, but we know that it's important to have a regimen, a really clean, organic regimen for cleansing the face. And then there's got to be some kind of, if you have acne, sometimes some targeted ingredients to help kind of clear up the acne. So I'll let you jump in, Jamie, on any ideas you have.
Yeah. Oh, yeah, totally. So, what you were saying about one of your biggest pet peeves of women who have PCOS who are given the pill, and it's all like, again, these fake estrogens, which they're already dominant in anyway. I think about that too. When we think about women, again, with PCOS, if we're wanting to get off of the pill and you're thinking, okay, what's my life going to look like now? I would say one thing for you in particular is to think about whatever you're going to put on your physical face or your skin, which is your largest organ, that it is natural and organic. I mean, things are expensive. Life is crazy. I mean, where are the lines? How do I know what's important? Whatever. But the thing I was just saying the other day to a client of mine, I'm like, the things to start off with in terms of trying to reduce endocrine disruptors in your life are the things that are the least expensive things to change. So this is just the beginning point, right? So the easy stuff, like the cleaners, like vinegar and baking soda and lemon, whatever, those are really inexpensive. We don't need fancy stuff. That stuff does the trick. That's the first thing. Second thing is what is on your body or face or skin or whatever the longest. So when we think about that, like even if you were to use an example of showering, when you put shampoo in your hair, you're putting it in your hair for like 30 seconds, you're lathering it. But if you're putting your conditioner in your hair and you're letting it set for 2 minutes, that's a longer amount of time on your body. So I would say if you had to choose the natural conditioner, because again, the shampoo is not going to be on your head for that long. Same thing again with this whole PCOS thing and excess estrogen, like your makeup or lotions that you put on your body and it's just going to sit there. Like think about that. Your laundry detergent, when you clean your clothes, whatever you're putting in the dryer, you're wearing your clothes, it's on your body. So that's always where I tell people to start because it can seem so overwhelming. Mm-hmm. So for that, but in terms of other symptoms of post-birth control symptoms, so we talked about acne, but also women notice headaches and depression and mood swings. They notice anxiety, painful or heavy periods again. So think it just, if you're considering getting off of whatever you're on, just take note of, okay, what was I on the pill for the first place? And then some of these things I will likely notice, but it's never too late to get started with kind of replacing some of those items in the home and start thinking, what's your action plan, basically.
Yeah. So that's great. And I do want to mention a couple of tips and tricks because I know acne is a big deal. So you're all wondering, like from a supplement standpoint, is there anything I can take for my acne? And because this testosterone issue is many times a problem, not always, zinc is really good for helping the body process out androgens. So zinc 15 to 30 milligrams a day would be a great option. And then also, if you're looking for like an herbal, saw palmetto is also a way to naturally decrease androgens in the body. So saw palmetto I'll often use for people with hormonal type acne or in polycystic ovarian syndrome. And then, topically, I also, work with a dermatologist, but just tell them going in, hey, I'm not looking for hormonal contraception for my acne. Tell them right off the bat, Give me some other solutions. There are some great dermatologists out there who have some great ideas. Retinol. There's lots of topical solutions, benzoyl peroxide, salicylic acid, clindamycin. I use metronidazole myself for some patients. I use compounding pharmacies to make, multiple ingredients in one. So there are a lot of options. You can find good dermatologists. You got to be upfront and just say, hey, I'm looking for the alternative. And if they don't have it for you, move on to the next one.
Right.
So some of these other symptoms, again, what we want to think about with post-birth control syndrome is what is happening. Again, you have been in a suppressed, and this is like a pituitary problem, right? We suppressed the hypopituitary axis so that our messenger hormones are not talking to our ovaries. And when that happens, again, you have dysregulation of other hormones as well. So our adrenals are affected. Our thyroid is affected when we're on the pill. Those are also not, they're just like underperforming, you could say, right? They're just not functioning at their highest level. It makes sense, guys, right? We have God-given natural hormones. They were made to function perfectly. And when we put these synthetic hormones on our body, they just don't, And again, so we have to look at why, do we really want to do that? There are some cases people choose that they do want to do that, but we want to know, is there an alternative? And there is, of course. So when you come off of the pill, remember your body's like trying to figure out how to get this whole system back together again. And it starts like a lot of things in the gut, right, Jamie? So the gut has been really impacted by the pill. And so when you come off of the pill, the gut has to restabilize its microbiome because the pill has been associated with leaky gut or intestinal hyperpermeability. And so we need a lot of time. Things don't fix magically overnight. So nutrition and supplementing some vitamins that have been depleted by the pill now become really important at this time when you're coming off and trying to heal.
Mm-hmm. Yeah. I was just meeting with a gal yesterday and she is on birth control. It was for PCOS, but she's wanting to get off of it. So it's like this episode is basically for her, but she's talked about how when she went to the doctor, she has like a very deficient vitamin B. Her vitamin B levels are very low. And I'm like, well, you know what? That makes sense because birth control does deplete our B vitamins. And so that's one of the things that we do tell women to make sure that you amp up the B vitamins. Because again, those are being depleted along with many others. Like you said, zinc, magnesium, those are three that we would say to really think about getting into your home. If you're getting off the pill or you plan too soon, your B vitamins, zinc, magnesium, super duper important. And like, Teresa said with gut, earlier in our season here, we talk a lot about how our hormones, they like our immune system, our skin, integumentary. Is that how you say that, Teresa?
Yeah, I think, yeah, I'm not even going to try because
our hormone system, like 90% of serotonin is produced in our gut. Like our gut is so important. It makes sense because if our gut is inflamed, and it's leaky, and maybe it's because, again, we're using birth control or toxins in our life, we're not living a healthy lifestyle. There's other things that can cause a leaky gut and an unhealthy gut, right? But it makes sense that would be like the pinnacle of health is a healthy gut because we need a healthy gut in order to absorb the nutrition that we're consuming. So when people come to me and they're like, what kind of nutrition or like supplement should I start? I'm like, well, what's like, how's your gut? Are you pooping? Like, or just how are you feeling? Do you feel bloated? Do you have signs of maybe excess estrogen? Because if so, that's great. We want to think about supplements and proper vitamins and things. But if your body's not absorbing them, then maybe we should get your gut in line first. And we can do that with healthy foods. We can also do that with, probiotics, anti-inflammatories, and that kind of thing.
Yeah. And I think, doctors like, 25 years ago, we kind of scoffed at the leaky gut word, but now probiotics is kind of like a natural thing for doctors to recommend. So this research around leaky gut syndrome is increasing. And I think there's an awareness now about how it affects the body. One thing that I've noticed with my patients coming off the pill, especially the ones that have been on it for really long periods of time, we're talking plus 10 years, is that the body, if you think about the gut and how those proteins in our food, okay, normally our body has to keep that all in the gut and process it. But when it leaks out into the bloodstream, the body, from an immune system standpoint, is a little bit going on haywire. It's like, what is all this stuff in my blood? And the immune system has to figure out, is this foreign, natural, and process it to the right place or get it out of the body. Well, guess what that leads to? An increase in autoimmune issues, right? Because when the body's immune system is trying to like go into hyperdrive, it can get confused about what's natural and what should be there and what shouldn't be there. And it can accidentally start to confuse natural tissue with foreign tissue. And I have seen at least 3 cases now of autoimmune issues that really attack actually the vaginal tissue. They cause a vulvodynia basically. And the pill, like you said, depletes all these nutrients, but we know the pill also decreases estrogen at the place of the vaginal tissue. So painful intercourse can be a problem with people on the pill. And these women that have been on it for so long, their tissue is basically atrophied, and it can cause like an immune system response that leads to just severe irritation, itching, almost like a hypersensitivity of the vaginal tissue, dryness, pain with intercourse. And that is so frustrating for women. And this is just one area that you could say autoimmunity may develop. We know the thyroid is a common autoimmune area to develop too. And these things definitely can be helped, but we're talking, 9 months, a year, sometimes 2 years to properly heal from these. And it takes a lot of work on the gut and healing the gut first, and getting those proper nutrients, and then really giving supportive care to like the vaginal tissue. We might use estrogen in its natural form, or a weaker estrogen I often use called estriol. But I just want you to know that that's a possibility, and know that your story about being on birth control for many, many years and knowing that your body has changed, you guys, these stories are real. You're not making it up. And I know sometimes your doctors are not listening to you. And if they're not, find somebody who will, because these things are really happening and we want to help you heal and restore again.
Yeah, totally. And there's just one more thing I really want to make sure we share. And I'm really glad, Teresa, that you talked about, like, if your doctor isn't listening, or, at least willing to learn more about this, to consider, going somewhere else. Because a lot of women do suffer just generally, let alone like with post-birth control. Women are maybe taking, step out in faith, gosh, okay, I'm really interested in learning. And then, they get this feedback that isn't positive. So I just want to affirm those women that are looking for a change. Okay. The other thing I want to say real quick, the liver, just real quick. Okay. So women, if we think about, again, our everyday life, earlier on, we talked about, endocrine disruptors, xenoestrogens, which are like the fake estrogens, that kind of thing. So our liver is a filtration organ. It's very important that our liver is working well, that's functioning well. But unfortunately, it's like the more it gets, used and abused, the less, effective it can work. So a good example is like a colander or a strainer. If you're pouring your noodles, you're making spaghetti, you're pouring it into the colander or the strainer, but then the little plugs or the little holes are plugged, then of course, like the liquid cannot flow through. So that's similar to, I always use that as an example. It's similar to the liver. Anyway, for women who are getting off the pill, you're going to want to do like a liver detox, care for your liver, ladies, because again, it's not something that people talk about a lot, but some of those things that we can do, like we were talking about before, is cleaning up your home, cleaning up your cleaning routine, your self-care routine, because the liver is really going to need some of that care when you're done with that pill. Mm-hmm. Hopefully, if that's where.
Yeah. And I know, Jamie, you've got some ideas for gentle kind of liver detoxes. I mean, you guys, be careful. There's all sorts of supplements out there, and you don't just want to go crazy and do some massive juice cleanse for a month, get professional support for that, and find somebody who really knows how to do that correctly. Mm-hmm. And I'm not an expert in that. I know the liver it's like the master sponge. it really does take on every toxin that we put in our body, and it has to figure out what to do with it. So if we do not know how to process it through the liver, we are holding on to those toxins, which goes back to Jamie's point about, pooping.
Yeah.
Again, guys, if you are not eliminating stool every day, you are just circulating toxins. One of the most important supplements I think out there is magnesium. You'll hear magnesium over and over again, but magnesium helps not only like a zillion functions in the body, and where most of us are deficient in it, but it also helps us eliminate stool. So if you are a constipated person, think about mag citrate. The form that I like is natural calm, or it's called calm magnesium. Anybody can get it online or at a health food store. It's just a powder. It's mag citrate powder. If you have constipation, that works really well for most people. If you are just mildly constipated, you can use a form of mag glycinate. 300 to 400 milligrams a night is great. Sometimes people need more though. Listen, you basically want to use magnesium to kind of a bowel tolerance. Like you got to get yourself going. So use enough to make yourself go. This is so important. If you're not pooping, literally, again, you cannot eliminate these toxins and the toxins from the pill.
Exactly. What would you say is not pooping enough? Like once a day is enough, every other day?
Yeah. It should be every day. It should be every day. And, you can look online. It's totally gross, but it's called the Bristol poop chart, And your poop should look like, a snake, basically. It should be not too loose and mushy. I think it's a number 3 that is the normal. It shouldn't come out like little rabbit turds or big clumps. It should come out like one long snake, and at the end, honestly, there shouldn't be much wiping. I know that's, again, a little graphic, but it should be clean on the end. So you may need to look at your water intake. It's another one. You need to hydrate super well. And it really should be every day. And this is a common struggle for women. So if you're in this boat, don't feel alone. You guys, every day, pretty much, I talk to a woman who struggles with constipation. You are not alone. There's just so many factors. And I think there's some psychological factors too for women, just in terms of like, we spend our whole lives so busy, we just never had time to poop. So, it's just, we really have to focus on it. So if it's something you've been not addressing, today is the day to start addressing it.
Yes, exactly.
Yeah. So, and then the mental health issues that happen with the pill, whether you've been affected being on the pill and you had anxiety going on it, or maybe you had a mental health issue and you're coming off of the pill and you're having more anxiety. The anxiety does come from the imbalance of the hormones that are occurring from detoxing the pill. At times, it's messing with those neurotransmitters. So just one, know that that is real. 2, magnesium is another kind of calming way to help that. Sometimes I need to use some bioidentical progesterone because progesterone helps calm those happy hormones. There's other modalities that can be used that are natural. Sometimes some adaptogens like ashwagandha, GABA, some other, kind of supplements. I definitely just want you to know that you need to make sure you talk to a professional if you're having anxiety and depression issues, because it's something you really shouldn't suffer with.
Right. No, it's so true. It's so true. Okay. Very good, ladies. Teresa, what would you say is the number one tip for women who are considering getting off the birth control pill?
The number one tip I would think is just one, don't be afraid. If you've been thinking about this, if intuitively in your heart, you believe that artificial hormones are not good for your body, then don't be afraid. You can do this. And I promise you that it will take time sometimes, but you can heal and restore. So don't be afraid. I mean, number 2, learn to chart, learn to know your body. I mean, this is the foundation of our podcast, is women being empowered to understand their own body. And it takes learning, education, and motivation to chart on a daily basis. Your body, your menstrual cycle is a vital sign. It tells you what is working properly. And without charting, you really won't be able to measure that vital sign. So charting being very important. Number 3, do not forget the nutrients. Again, if I could just say, like, again, a tip for everyone either if you're on hormonal contraception or not, most women could benefit from a prenatal vitamin. It's a glorified multivitamin, but it has the extra B vitamins. It has the extra iron that many women are just starving for. So you can never go wrong with a prenatal vitamin and that extra vitamin D3. We're all deficient in D3. It's been proven. If you don't take a supplement, 2000 IUs is a good, healthy standard dose. No one can overdose on 2000 IUs of D3 daily. So a prenatal D3, maybe add that magnesium at bedtime, and anybody would at least be set up for a good foundation in nutrition. And then, like Jamie said, we've got to look at the gut, and we've got to look at healing through nutrition and lifestyle. Lifestyle and nutrition are you don't need to go to a doctor for it. And frankly, most of us don't need to go to a doctor if we just knew how to heal our bodies naturally through nutrition and lifestyle. And so you've got to look at, what am I feeding my body? Is it good or is it bad? And we all intuitively, I think, know what needs to be eliminated there. We need to hydrate better. We have to sleep more, and we have to de-stress. We talk about those things all the time. So those are my kind of, I think, big tips there for coming off of the pill, but don't be afraid to do it. And we're here to help you. If you want to email us, thehormonegenius@gmail.com. If you're afraid, if you want support, please know we're here for you too.
Yes, yes. And Teresa, I'll just take a minute too and just share. So I train women to be hormone coaches, basically doulas for your hormones. So while all this information is super helpful, and hopefully we're giving you, the ammo to make change in your life, sometimes it still can seem so overwhelming. And women were meant for community. And so if you need help, if you need somebody, like I need somebody to walk with me through this, please reach out. I can get you connected to a hormone coach. Like I said, a doula for your hormones. Like my passion in life personally, and I know Teresa's passion too, is to give women options. I just see it as such a major injustice within women's healthcare that they're given a birth control pill, a Band-Aid effect, essentially. It does not restore health. It does not make that woman healthier for using it, for issues that could be addressed naturally, just with some guidance. And so that's what we do. We guide. So let us guide you if you're open to it. That is, again, a calling from the Lord, I believe. I just really am passionate about that. So if you need support, please reach out to the podcast, and then I can get you connected to someone who can doula you through this process too.
Yeah, that sounds great. And, Jamie, again, I always think when we get too close to the end of an episode, all the things we didn't talk about, so I'm thinking, of course, about like the fact that when you come off of the pill, you'll either have your period right away, and it could be light, it could be heavy, or it could not come at all. So there's, of course, post-pill, like amenorrhea, where your period just doesn't show up for a while. And if you come off the pill because you want to get pregnant, obviously that can be like super freaky out moment. You're like, what? I'm not getting my period. Certainly not going to be able to get pregnant. But this is, again, these are those things we have to think about. Why did we go on the pill? Is this good for women? If when women come off, they can be in these situations of their body not working correctly. Just know that all of those things, not having your period, heavier periods, again, we talked about estrogen dominance a lot, that can be addressed. Irregular cycles, if it's PCOS, we have great solutions for that naturally, and with good, proper medical management. So all of these can be addressed, but know that these things do not correct overnight, and it will take time. Think again about charting. You can go to fabmbase.org. You can go to managingyourfertility.com, femfertilitycare.com. .org, for charting information. Email us. We can put those in the links. All of these great places, you got to chart, because if you want to know if you're ovulating and if your hormones are working right, you've got to chart, everyone. So this is a great episode, Jamie, on post-birth control syndrome. Hopefully we'll do a follow-up one down the road. You have any last words?
No, I'm just really excited for those of you listening to us. And we just want to affirm all women who, again, are on the journey to become the genius of their hormones. Thanks for listening, everyone.